My name is Dr. Daniel Rivlin. I'm the founding partner of Miami Beach Skin Center. This is Julie, and today we're going to do a little Botox on her. She's mainly concerned with these lines in her forehead. You can see when she raises her eyebrows, she gets quite a furrowed forehead here. And we're going to try to use Botox to paralyze this muscle here, which is called the frontalis muscle, so that this movement can no longer be made by her. And consequently, at some point after she's been paralyzed, these lines will disappear. In addition, if Julia smile hard, you'll see there's a little bit of movement here when she smiles, causing some crow's feet. And we're going to use Botox to paralyze this muscle, so when she smiles, she doesn't form the crow's feet. She's actually a bit asymmetrical. You can see the crow's feet are a little more prominent on the left side than on the right. And also, she would like a little more arch to her eyebrows, and we're going to use the Botox to take care of that. It's important to use a board-certified dermatologist for Botox, because whoever is injecting the Botox must know what the anatomy is, so that the right amount is used, so the patient gets increased efficacy, and also saves money so that the overtreatment does not occur. When we use Botox on the forehead, I think it's very important to get a very even distribution of the Botox. So what I like to do is outline the frontalis muscle. So Julie, if you'll raise your eyebrows for me. We get the lateral borders here, and we outline them this way. And then we bisect in the middle, and then maybe bisect each side again. And since she has a somewhat high prominent forehead, we're going to bisect in the other direction, so that we will horizontally bisect the frontalis muscle. And that way we can inject into each of these little squares an equal amount and get a nice even distribution of the Botox. All right, I'm going to need 1, 2, 3, 4, 5, 6, 7, 8 threes.
Okay.
And on the crow's smile hard, a 4 here.
Forward.
4. I'm going to need probably 2 4s. Okay?
That's it?
Yeah, 2 4s, because she still has some effect from the last time.
And
then
then
the 2 2s for the... Raise your eyebrows. Are you uneven on your brows? No, they raise evenly. For whatever reason, you just like to raise the right one more. Okay. So we're going to get started here. And as you see, we've evenly divided the forehead into 8 squares, 4 superiorly, 4 inferiorly. And we're going to inject 3 units of Botox into each individual square to get a nice even distribution of the Botox. As you can see, we put the 3-unit aliquots into individual syringes so that there's no chance of over-treating a particular area, and we use a very small 30-gauge needle, which minimizes any discomfort. So Julie, go ahead and raise your eyebrows, and we will inject directly into the muscle band. Okay. We'll do 3 units at a time, trying to get in the middle of each square or rectangle. And we keep going. And again, you notice it's a very superficial injection technique, because the muscle is just under the skin, so you almost want to raise a little bleb every time you inject. Go ahead, Julie, raise your eyebrows again. I'll do the same thing here. Good. Good, and you see the little bleb being raised. There's just a little drop of blood right at the needle insertion site. And a little bit of Moncel solution takes care of that. And Julie's doing a very good job of keeping her eyebrows raised. Okay, now what we want to do is we want to massage everything in to try to get as even a spread as possible. So we massage both directions, vertically and horizontally. Okay. take care of the forehead. Okay? Now we're going to take care of the crow's feet. So Julie, go ahead and smile as hard as you can. And you'll notice there's a little bit of movement here. She still probably has a little effect from her last Botox treatment and a drop of movement here. So we're just going to get the active areas of the orbicularis muscle. So go ahead and give me 4 units. Go ahead, smile hard. And we're going to go right here where she still has a little bit of movement and raise a bleb, because again it's a very superficial muscle. And one more time down here. And again, just rub it in. And get a nice even spread throughout the entire lateral part of the orbicularis oculi muscle. Okay. And you see she has a little bit more movement on this side than she had on the other side. I'm going to give her again just an injection. She's actually okay superiorly. So go ahead and smile hard. And we're going to put it right in the muscle band right here. Good. And a little bit in the lower part right here. Good. And that should take care of that. Now we're going to take care of Julie's eyebrows. We're going to try to get a little more arch like she likes. And if you notice, she tends to arch a drop more on the right side than on the left side. So I think I'm actually going to give her a little bit more Botox on this side, just so we can even that out. And it's important to discuss with the patient where they would like the peak of the arch to be. Julie does her own eyebrows, so she always likes the peak to be right where she's designed it with her eyebrows. So this is exactly where we're going to inject the Botox and try to get that little peak to rise up a little bit, as she's doing right now, sort of voluntarily. So 2 units is what we use. I'm going to go just below the eyebrow, right at the peak, and that should take care of that. We're going to do exactly the same thing on the other side. I'm going to come over. Go ahead, raise your eyebrows right in here. Good. Okay. So it takes about 2 to 4 days for the Botox to usually kick in. So it's important for the patient to know that they don't walk out of here with an instant result. And then we like to check the patient about a week later and make sure that we've gotten an adequate result. Everybody's anatomy is slightly different, so sometimes we do have to touch the patient up in a week. And if they need it, we'll do it. Hi, I'm Dr. Daniel Rivlin, and this is Julie, and we've brought her back. It's now 1 week later after she's had her Botox injections, and we're going to see how she did. So Julie, do me a favor and raise your eyebrows. Hard as you can, and you can see she can barely move, but there is a drop, just a drop of movement on this brow. So we're going to fix that so that she's perfectly symmetrical. And now we'll check her crow's feet. Smile, hard as you can. And that's perfect. We have no movement at all. So you can see it's a beautiful result. No lines around the eyes. And we're just going to fix the drop of movement that she has here to make her eyebrows perfectly symmetrical. And that'll take care of it. So, Julie, I'm going to just ask you to raise your eyebrows so we can see where the movement is. We can see this muscle is just moving a drop. A little pinch right here, and that's it. And that should make her perfect.